As you heard from Eleanor, we are now 6 days out from the procedure. She's coming a day early because I'm going to be out of town this weekend doing some lecturing in Newport Beach. But as you heard, she's doing well. There's not really any discomfort. It's just a really tight feeling. And I just want to emphasize that to people that are coming in and doing this. It does feel abnormal to smile. It feels a little bit weird. And the movement of her lips, something I actually really wasn't picking up on beforehand, but I'm always hypersensitive after a procedure and looking at it, is something she's always had, but that can be, the lower right lip can be actually balanced out very easily with a little bit of Botox. As you heard, part of what I think is so fun with this procedure is, one, is really to match out old photographs so that she looks like herself and her identity is not taken away from her. But what's also very interesting and fun for me is to take a face that's already attractive but take it to another level and really create, I like the word harmony even more than symmetry, because what Eleanor was talking about, her eyes being slightly larger, I can frame that eye even better than someone else that really would benefit, but in her case she benefits tremendously from an aesthetic capacity. And so what I was trying to do with the neck, as you heard, is even a neck tighter than a 15, and I think we can bounce a quarter off that neck, which is exciting. I wanted to show those incisions now at 6 days. Go ahead and turn over this way. You can see there's a slightly pulled look just at the bottom of the incision line, but you really can't even see the incision line, and there's a little bit of congestion and swollen. That's why you can see the depth of the incision there. That's totally normal. The little bit of a bunchingness around the bottom part of the ear, that will also dissipate. I never go in the hairline. I actually had that discussion with Eleanor earlier this morning. I wanted to actually reiterate that I don't take out hair. The incision line is literally 1 millimeter at the top of the ear, and that's the full extent of it. So there's no compromise in the hair, or nor do I go in front of the hairline, which can also be a major problem. No matter what everyone tells you, you can see that incision line if you go up in that area. Turn to the other side. And again, you can see a little lumpiness and bunching along the base where that's suspended. That will take another week to dissipate, but that will completely settle out. And also, you can really see how tight that neck is compared to her preoperative photographs. And sometimes that also loosens a little bit. It won't actually loosen, but it will just get a little swelling there, then it'll come back up. There's one other thing. The reason why her neck is so tight, even compared to her youth, is that there was a component of fat that sits between the muscle bellies that even with her previous liposuction, they couldn't get at. And what I did was actually, this is a procedure that most surgeons don't do, is actually I hand remove that fat and then double, triple imbricated, I can't even speak this morning, imbricated her platysma muscles, so that neck will be even tighter than in youth. And that's what's so exciting about this, without skeletonizing the neck, without taking the neck and making it hollow looking. And that's very important. That's a right angle you're looking at right there, and that's a very youthful look. So that's where we are today, and we'll follow Eleanor along, and I hope you have been enjoying this video journey.
Hi, I'm 14 days out now, and I've just looked at my before and after pictures. And there's a huge difference. I love the framing around my eyes. That has made a significant difference to the way to looking older versus looking much younger. So I'm very, very happy about that. A lot of the swelling has gone down. It seems like most of it's gone down, and things are looking good. So I'm excited to seeing myself 6 months from now. So, and Dr. Lam is a fantastic facial artist. So I highly recommend him.
Eleanor is 14 days out, as you heard, and this is still swollen. I know she loves what it looks like right now. It does look great, and it will continue to look great. There's just a little bit too much puffiness into the cheek and jawline area, but that's a very beautiful, youthful look. She'll still look great when the swelling comes down. She is still swollen, but everything looks really, really good. She was asking also on her neck. There's a little congestion right in the neck, but let's turn to the side and we'll show that there. You can see it's still a very tight neck, but she's seeing a little bit of swelling now that she didn't see a few days ago, and I told her that's normal. Most of the swelling is now moved down into the neck area, and because I create such a tight neck, there's a little bit of congestion of the muscles, so there's a little fullness. Go ahead and sweep your hand to cover the, I just want to show them where you are at 14 days right now. As you can see, about 90% of the bunching is gone. There's just a little bit left right around the ear, and that's going to continue to dissipate. There's a little bit of fullness around the ear, but this is really not noticeable, except if you look up close in the area. Let's look at the other side. If you can go and expose the incision line, it would be great. And this is again 14 days out. You can see a little bit of bunching still left around the ear. That will dissipate and settle completely. And you can see that but there's a really nice tight jawline there, and that's just normal to have a little bit of swelling around that area. And Eleanor is doing very well.